Questions and concerns have been pouring in as new information on symptoms and treatments circulates by the day. Family physician Dr. Jennifer Caudle joins us now with some answers. Good morning to you, Doc. The first one here is from Kathy on Facebook, and she wants to know, is it true that losing your sense of smell and taste may be a hidden symptom of coronavirus?
It actually might be. We have received reports out of the UK and other countries from ENT doctors and other specialists that some of their patients have had loss of taste and loss of smell. We also have had anecdotal reports from people in the States who have had coronavirus and said that they had the same. So I think this is something we need to be looking out for. Certainly we need to look further into it.
I mean, you add it to the list of things that we all, go through the check down every single day to see if we have any of these. So, I mean, it's good to know and keep up on this information. Here's an Instagram post by Wendy who says, does the virus attack men more than women? And if so, does that have any significance? What do you say about that?
Yeah, well, I do think it's very significant. And some of the preliminary data that we're getting from Italy and other countries suggests that in those countries, men have been infected in cases more than women and sometimes more severely. Now, we have yet to see what the data is going to show here in the United States, but yes, gender data does matter. That would help us determine which way we move forward, try to figure out why this is happening, if this proves to be the case here in the States, but we always have to pay attention to data happening from overseas.
Glenn asks, can a CPAP machine serve like a ventilator? It's a good question.
Yeah, it's a really great question. CPAP machines are generally used for obstructive sleep apnea and a few other conditions. The short answer is no. We need something a little bit more complicated and high tech, I guess, or just having more functions for a ventilator. Remember, if you have respiratory failure, meaning you need a machine to breathe for you, you're going to need a lot more than just a ventilator as well. So a CPAP that we generally use as an outpatient setting at home is not going to work to help ventilate your body and take care of all your needs at that time.
Okay. Anne asks, can old folks tolerate the anti-malaria drug?
Yeah, that's a great question. So we're talking about hydroxychloroquine, chloroquine. Remember, those are drugs that have been around for a long time that have prevented and treated malaria. But also remember, hydroxychloroquine is a common medication that we use for conditions like lupus and other rheumatological conditions. The good thing about this is that, yeah, older people can take these medications just like younger people. It really just depends on the safety profile of that particular person.
Yeah, they're looking into all that right now, what that will do. All right, one from Christy here. Does the heat kill the virus? If so, how has that been determined?
Yeah, that's a great question as well. A lot of people are wondering, and lots of sort of ideas swirling around about heat. Now, there's two sides to this. One is the myths about heat that we're seeing on the internet. There are some people saying that a blow dryer will kill coronavirus, that sitting in a sauna or drinking warm water will kill coronavirus. That is not true. However, when it comes to temperature, that's a question we've been asking ourselves. If when it gets warmer, will we see less coronavirus? We know that typically viruses don't do as well in warmer and humid weather. Whether that's going to be the case for this coronavirus or not when the temperature gets warmer, we still have yet to see. So the verdict is out on that. But just remember, some of these warm water and warm remedies, they're not going to kill coronavirus.
Yeah, but then you wonder, if it does kill it in theory for the summer, like a lot of people worry about the fall. So we'll continue to keep an eye on this, all the latest information. Dr. Jennifer Caudle, thank you so much. Appreciate it.
Thank you.